Assalamualaikum guys. So today we are with the last lecture of our day, and the topic is current and emerging diagnostic techniques for oral squamous cell carcinoma. And I have our guest speaker, Dr. Saima, but I would like to welcome her without any delay. Assalamualaikum, ma'am. How are you?
Walaikum assalam, Farooq. Alhamdulillah, I'm good, doing good. What about you?
Ma'am, you can take from here.
All right. Thank you so much, Farooq. First of all, thank you for inviting me to be a speaker at this forum. And let's get right to it. I will start. So, as Farooq already said, that the topic of my presentation today is going to be about the current and emerging diagnostic techniques for old squamous cell carcinoma. All right. So, let's talk a little about what head and neck squamous cell carcinoma or oral squamous cell, which is a part of the head and neck cancer, is. So, basically, head and neck squamous cell carcinoma in today's time is the sixth most common malignant tumor worldwide. And despite numerous advancements in the surgical techniques as well as chemotherapies and radiotherapies, sadly, the 5 year survival rate of 50% has failed to improve over the past few decades. Now, as a result of that, we can see that the global incidence and mortality is about 500,000 new cases every year. This is a very alarming number, right? Everybody, I mean, if you can see that having 500,000 cases every year is a huge amount. And on an average, the mortality rates in the males is about 3.1 per 100,000, and in females, it's about 1.4 per 100,000 of the population. Again, this is also a very, very alarming number. And although this is these stats are about 4 to 5 years ago, so I am thinking that most probably the incidence and mortality must have increased a lot by now as well. Um, Sadly, again, Pakistan falls into a high risk head and neck cancer geographical zone, and what I find very critical at this point is that despite Pakistan falling into this very high where the cancer head and neck cancers are about the second most common cancers in Pakistan, right? Despite that, there are no comprehensive databases or registries that are available regarding any disease, not just per se cancer, but any disease in Pakistan. And the only data available is hospital based, which means that every hospital obviously annually, they generate their own data of as to how many cancer patients they received and how many they successfully treated, how many are in remission, and so on. But these are only institutional results, right? So that does not give us a very comprehensive outlook on what actually the numbers are. If I look into an X hospital and I look at their numbers, maybe there are multiple factors which would affect the number of patients that are presenting there. So the data that I may find at one institution may be very, very skewed. For example, if I go to Shaukat Khanum, of course, it's a cancer hospital. So all the data will be regarding the cancer, and I will find very high numbers. Whereas if I go to any other tertiary care hospital, obviously the number of cancer patients presenting there will be far lesser than that of any specialized hospital. Therefore, it is of much importance at this time that we need certain registries so that we have a collective data so that we can work towards the betterment, better diagnostic aids, better early diagnosis. Since we don't know the numbers, we don't know what is happening, what kind of oral cancers are we getting, what type of head and neck cancers are we getting, it gets very difficult for us to work towards the betterment, right? So, if we look at a few risk factors, of course, tobacco and alcohol remain the mainstay. That is something that is very, very well established. Tobacco in different forms, chewable as well as smoke and smokeless tobacco, is a more common factor for oral cancers in the eastern region. whereas alcohol is a more common cause for oral cancers in the Western world. Other aiding risk factors include certain environmental factors, genetic factors, lifestyle, and microorganisms. So that is why they say that cancer is not just one factor, it's a mixture of a lot of other factors that we talk about. I mean, look at the kind of food that we're eating these days. Of course, there are certain genetic susceptibilities as well. That's another issue. But then certain microorganisms, there are certain viruses that are implicated in the causation of oral cancers. The environmental factors, where we are living, how we are living, the living conditions, so all those things. We have a very sedentary lifestyle these days. So these are all risk factors that accumulate or push us towards cancers. All right. These are the different clinical presentations. If I may, let me show it to you guys. See, there's an exophytic growth. Oh, sorry. All right, so this was a transition. That is why I'm sorry. Something happened. It's not transitioning. Anyways, this is an exophytic growth. An exophytic growth is something that is protruding out, right? This is an endophytic growth. That is something. It's like an ulcer or sloughing away. In this, you can see a leukoplakic type, which is a white patch. Over here on the right, you can see an erythroplakic type where there's a red patch, and then at the end of the day, there's also a erythroleukoplakic type, which is a mixture of a white and a red lesion together. So, oral cancer has many different clinical presentations. That is why you see the we talked about the mortality and the morbidities and all rates, right? So, the high mortality as well as the morbidity rates that are associated with this disease and its various clinical forms that I just showed to you, the clinical and the histological presentations, warrants the need for an effective screening method and the development of early diagnostic tools. We all know that before we treat anything, diagnosis is of utmost importance, and the right diagnosis is of utmost importance again, right? So that is something that we really need to work towards during this time. Um, all right. So the current trends in diagnostics that we are doing currently for the oral cancer includes the clinical examination. We all know that once the patient presents to you, what do? You're obviously, the first thing that you do is take history and go for your clinical examination. The most common next thing, which is still the gold standard, is that we go for a biopsy. Right now, the type of biopsy that you're taking, it could be incisional or excisional, depending, or any other type, but mainly it's the incisional or the excisional. We go for a biopsy, right? We're using certain imaging techniques as well, of course, to aid in the diagnosis, like CD scans, or we have MRIs and we have PET scans these days, which are being commonly used. So these are currently the things that are being used very commonly. Then another mainstay of the diagnostics in the last 10 or 15 years has been the use of biomarkers. Now, all of these are basically currently done to do what? To determine the extent of the disease and for the histological confirmation if it's a malignancy or not. Right? So this is the basic purpose of the diagnostics that are being run these days. So we do know about clinical examination and biopsy and everything, but since biomarkers has been a recent, not a very old thing, so I decided to talk a little about the biomarkers in the diagnostics as well. So research was done a while ago, and Halka and colleagues, they defined biomarkers as cellular, biochemical, or molecular alterations that are measurable in the biological media, such as the human tissue, cells, or the fluids. So basically, you're using a human's own biochemical or molecular stuff to identify the disease. For example, so if you see that the markers at a molecular level are basically divided into four very basic classes, like the tumor growth, that those that show you tumor growth, others that would show you tumor suppression, those that respond to immune response, and the others that basically show the angiogenesis or the invasion of the tumor. And also some talk about the some biomarkers are used to measure the metastatic potential of that particular cancer. All right. A very new emerging trend has been to use the saliva, right? Now the question may arise that people have been saying, how can you use saliva and all that? But you see, if you see here, saliva, whenever there are any kind of genetic mutations or any altered gene expressions or any altered protein expression, they all express in the saliva. The proteins are already present in the saliva, and they can be used to detect the DNA, RNA, or proteins, and respectively you can go for genomic analysis, proteomic analysis, or transcriptomic analysis. Now, the salivary proteomic data that has been available in the last 10 to 15 years, they have highlighted the potential use of biomarkers in the saliva as early diagnostic and screening tools for old tumors. See, why I would say that saliva is a very good medium to go for biomarkers is because it is easy to extract. You see, you don't for when you do a biopsy or you take blood samples, it is a little difficult for the patient, right? But asking him to give you a salivary sample is very easy. Also, it is very cost effective. You don't have to, for its collection purposes, you don't have to spend a lot also. So we also know that the most abundant proteins in the saliva are alpha amylases, cystatins. This is proline rich peptides, albumins, and so on. We know these all since we've been in our undergrads, right? So, depending on the biomarker type, as I outlined earlier, the potential salivary biomarkers can be studied. All these proteins can be studied using methods such as using ELISA technique, or you can do radioimmunoassays in them. You could go for a two-dimensional gel electrophoresis, which could be followed by mass spectrometry or a reverse phase liquid chromatography. And also, there's a newer technique that is referred to as MALDI. They can all be used in salivary diagnostics. And up till now, the studies, all the research that has been done has shown that more than about 100 salivary molecules have been identified as biomarkers for oral cancer. That is a very, very good news, because that means that a lot of study has been done, a lot of research, but that doesn't mean that we need to stop working on it. Maybe one of us can come up with a better salivary molecule that could probably give you a better result, right? So that could be done. um, okay. So now another emerging trend that has been used is the light-based detection system. Now these light-based detection systems are basically depending on the optical properties of the biological tissues, the tissues that are present in our body, that have emerged as a very, very viable diagnostic option. And the reports have shown that their ability to improve oral mucosal examination and also increase the detection of the pre-malignant disorders as well as OSCC. As you can see on the right, you can see there's a healthy tissue and a malignant lesion. So a blue-white light in the range of about 430 to 580 nanometers is thrown on the tissue, as a result of which in the normal healthy tissues it will be absorbed, whereas in the malignant tissues it is disrupted because because of the growth of the cancerous cells. This light is now distorted and it is disrupted, and it reflects back. So that will tell you, it will give you an insight into the malignancy of the lesion. So this is one of the I'm giving you a very basic insight, because if you go into the details of the different light-based systems, that's a lot. Like there could be chemiluminescence, there could be autofluorescence, and there's so many more that you could talk about, and it would have been out of the timeline that I've been given. So that is why I'm just touching on the different things, so that if Even if somebody is interested in doing a research for their postgraduate, just like that, if somebody is interested in, at least they have a little thing to talk about, that, oh, this is going on, maybe I could work on it, right? So this is one of the systems that are being commonly now emerging trend. Okay, another thing that is being commonly now is coming into action is doing the liquid biopsy. So there's a test system which is known as the cell search, which is commonly used for capturing and enumerating the circulating tumor cells for the prognosis. It has been liquid biopsy has been used for tumors like breast, prostate, and colorectal cancers. Therefore, it is not the time is not far that liquid biopsies could probably be used for the detection of oral cancers as well. So this is something that the scientists are looking into. Oral scientists are now looking into. So the only system that works in liquid biopsies up till now, which has been, actually there are a lot of systems, but this is the cell search is an FDA approved system. So it consists, what it basically has is that there is an automated instrument in it. What it does is that it captures and it also stains the circulating tumor cells. We do know that there are circulating tumor cells, and there are other exosomes and other things that are circulating in the blood, right? And what it does is that it captures those, and it immunostains those circulating tumor cells, and using a semi-automated fluorescence microscope, you can use it to scan it and visualize the results. So basically, you see, this is how a liquid biopsy is done. Moving on. See, another very emerging technique, which is very, very nice, which people are now working on, scientists are working on, is the use of nanoparticle based drug delivery for squamous cell carcinoma targeted therapy. As you can see on the right, there are different organic as well as inorganic nanoparticles that are present. Now they could be lipid based, they could be silica based, they could be macromolecules, or they could be a hybrid, right? So so this is not something that is new. Like certain anti-cancer drugs like cisplatin and paclitaxels and 5-fluorouracils, doxorubicins, you've all heard of about it, right? Are used alone or in combination for OSCC treatment. We know that. But the problem with them is that they have a high toxicity, they have limited solubility, there's a problem with the permeability and poor biocompatibility. These are a few problems that have prevented their further clinical application. Although they're they've been very potent drugs, but because of these problems, their further clinical application hasn't been possible. So to address these issues, there is a great demand for the targeted therapy. Now, what happens is there's a targeted drug delivery. These nanoparticles, they allow a targeted drug delivery system with the potential to improve the bioavailability of the drug as well as the distribution at the primary site. You see, by the time they reach the tumor, their solubility or permeability is not enough, or their bioavailability is decreased. That is why these nanoparticles will increase that, right? So this is something that is being looked into and has been, actually now they're being used in the West. Okay, then we have, okay, so as I said, the advantages of nanoparticles is that they have excellent physical and chemical characteristics, because of which they can be tailored to achieve the targeted drug delivery, which gives an improved biocompatibility and therapeutic efficiency. See, the most important thing is to have efficient and therapeutic effect for the drug, right? And also it is combined with the reduced systemic toxicity of oral cancer system. So that is a win-win situation, right? Now moving towards the active targeted therapy for oral squamous cell carcinoma, right? So these are the four different ways in which actively the oral squamous cell carcinoma can be targeted. They could be by gene therapy, by immunotherapy, by using the highly expressed markers, or biomimetic nanoparticles. Now, if we talk about gene therapy for OSCC, what is it? I mean, if somebody tells me, if somebody would have asked me like 5 years ago, what is gene therapy? I would have been like, I don't really know, right? But in today's world, gene therapy is existing. It is something that is what the scientists are, the molecular medicine people are looking into. So, human gene therapy seeks to modify or manipulate the expression of a gene or to alter the biological properties of the living cells for therapeutic use. So, you're actually altering the system, right? Now, it is a technique that modifies the person's gene to treat or cure a disease. Now, these gene therapies can work by several mechanisms. You replace a disease causing gene with a healthy copy of the gene. See, I mean, if somebody would have asked me 15, 20 years ago, is that possible? I would be like, what are you even talking about? But science has made that possible, that that gene, which is the problematic gene, you're replacing it with a good or healthy copy of the gene. Also, if you're not replacing it, you could go for inactivating a disease causing gene that is not functioning properly. So you just, you deactivate it, right? Or you introduce a new or modified gene into the body to help treat a disease. A totally new modified gene that is going to help you treat the diseases could be introduced into the body of the cancer patient. Now, the other one was immunotherapy. What is immunotherapy? We all know that immunotherapy is considered as a promising method in the treatment of certain cancers. We also know that there's a cell cycle and there are different immune checkpoint molecules. There are checkpoints and there are certain immune checkpoint molecules that are present there. Those molecules could be PD-1 or it's PDL, which is a ligand for that molecule, or CTLA4. They are normal components of your immune system, right? And they play a very important role in the immunoregulatory pathways of your body. Now, what happens is certain immune checkpoint inhibitors that target these, right? अब इनका काम ओरिजिनली क्या था कि ये आपके इम्यून सिस्टम को रेगुलेट कर रहे हैं प्रॉपर्ली, बट अगर आईसीआईज आ जाए उन जगह पे तो व्हाट दे डू इज दे टारगेट दीज मॉलिक्यूल्स, and they're very highly, these ICIs are very highly expressed in the tumor environment, and as a result they block these inhibitory pathways, right? इनकी controlling mechanisms को रोक रहे हैं, which contributes to tumor promoting immunosuppression. So you could develop immunotherapies you could develop vaccines, you could develop antibodies in response to these ICIs, right? That is another way of going about it. Then, if you look at the highly expressed markers for OSCC targeted therapy, these are again what? I mean, ये क्या हैं? इनका क्या काम है? These are guiding the drugs or the drug delivery systems at the tumor site using specific molecular markers and their receptors that are specifically overexpressed in cancer tissues. And it is a very promising therapeutic strategy. Now, in oral cancer, the widely used molecular markers and receptors जो इनकी ट्रीटमेंट में यूज हो रहे हैं commonly are the EGFR or the epidermal growth factor receptor, the folate receptor, the CD44, the integrins, or the urokinase plasminogen activator receptor. These are the molecular markers that are being used as the drug delivery systems or guided drug delivery systems very commonly. Okay, now these are of two types: the cell membrane for OSCC targeted therapy or exosomes. Now, either the cell membrane is being used in this case or the exosomes are being used for this purpose. The cell membrane, we all know that the cellular plasma membranes have reported to take part in many important processes in the biological processing that is going on in the body, and they have very high biocompatibility because they're present in the body itself. वो उसका अपना part है, right? And as a result, many cell membranes have been explored to generate very bio-inspired drug delivery systems for the therapy of the diseases. Now, because of their unique property of immune evasion and longer circulation times, as well as homologous targeting. Many cell membranes have been used to camouflage the nanoparticles. Now, some of these commonly used cell membranes for targeted therapies are the red blood cell membranes, the cancer cell membranes themselves, or the macrophages, or the macrophage membranes are also being used. All right. Then, if we move on to the exosomes for the targeted therapies, what are exosomes? These are basically a group of natural carriers that are already present in your body, and they're secreted from the cells to deliver numerous things from one part of the body to another, which includes the RNAs or the proteins or the lipids in the DNA. All right. Now, the exosomes are very, very ideal nanocarriers owing to their characteristic, because they have a very small size and they have a deformable cytoskeleton, so they can pass through anything, right? And more importantly, exosomes can not only escape the degradation, because they're the natural part, तो वो degrade होंगे ही नहीं ना, immune system उनको as foreign अब देख समझेगा ही नहीं, so उनकी clearance भी नहीं होती by the immune system, and they can easily cross the biological barriers, even the blood brain barriers, right? So exosomes, when they are combined with tumor targeted proteins, antibodies or peptides, it can achieve targeted therapy of the oral squamous cell carcinoma. Now, so having said all of that, what I want to say at the end, that the future is precision medicine. Now the question may arise at that time, that what is future? What is precision medicine? So precision medicine का goal ये है that it is to target the right treatment for the right patient at the right time by taking into account the differences in every individual's disease, their general health, their genes, their environment and lifestyle. See, it is different for everyone. Currently जो हम medicine follow क्या कर रहे हैं कि one treatment fits all. अच्छा ये वाला एक चीज है, हम कहते हैं ना फ्लू है, ये दवाई खा लीजिए. इसी तरीके से जब हम कैंसर्स की बात करते थे तो जी ओरल कैंसर है, चले जी इसको 5-fluorouracil से या डॉक्सोरिबोसिन दे दिया, ये I'm just at the top of my I'm just saying things, taking names. So the cancer patients, for example, with all these patients, they're all individuals who have their own health, own genes, environment, and lifestyle. All of them were treated with a single therapy, whichever it was at that time, right? But the future medicine or the precision medicine says that we will have more personalized diagnostics for every different person. Now, again, these are all several different cancer patients with their own things. So keeping in account their blood, DNA, urine, tissue analysis, and their environmental analysis, lifestyle analysis, the therapy will be tailored to different cancer profiles. For that particular patient, हर किसी के लिए उसकी tailor-made दवाई होगी. This is the future for every kind of medicine, especially cancers, because research has shown that precision medicine is the answer, right? So I would like to end my presentation here, and I hope whatever little that we've discussed today could be of help to somebody. And my area of expertise has been especially oral cancer, because I'm an oral pathologist, and this is what I really want to look into as well. And I hope this has been of a little help also for everyone listening. Thank you so much, Dr. Farooq.
Thank you, ma'am, for the great lecture. And after this lecture, I hope कि जो लोग oral pathology से belong नहीं करते वो भी oral pathology की तरफ इंशाल्लाह
I hope so, yes, because जी बिल्कुल, this is the future. I mean, अब हमें cancers sadly इस तरह से spread हो रहे हैं जैसे कि flus होते थे. So in today's world, this is of immense concern now.
जी मैम, बहुत बहुत शुक्रिया. Thank you, ma'am, again for the lecture.
Thank you, जी. Thank you.
It's the end of today's lecture and today's conference as well. Jazakallah. Thank you, ma'am.
Thank you. Allah Hafiz.